to the midline. Let's talk about the osteology. We will discuss each of the wall, the lateral, medial, roof and floor. The lateral wall, it is a very beautiful picture. I'm a little having trouble in placing the picture, the uh, place where I took the picture. You can write the see the name of the Dr. Muller. So D. Muller. So let's talk about the bones. This is a very beautiful picture as it adds the bones one by one. If we look at the lateral wall, the major bone that is contributing in the formation of this bone is this maxillary bone. This is maxillary bone is a very huge bone. It is on the front of the cheek. It is forming the hard palate. It is forming the upper jaw teeth, and it is forming the lateral wall of the nose. So it is forming a lot of the lateral wall, and in the lateral wall there is a hole of the big cavity. This cavity is the maxillary sinus. You will see as the bones are added one by one, they will form, they will close this cavity a lot. So this is the maxillary bone. Then there is a lacrimal bone. The lacrimal bone is in front of the maxillary sinus. It is attached to the maxillary bone. You can see the lacrimal bone from the orbital aspect also, and you can see it from the nasal aspect also. And it is between the two bones that you see the nasolacrimal duct. So before the origin of the bone, so here is the point where nasolacrimal duct was supposed to be. So here is the groove, and on the top of it the lacrimal bone was placed. So here is the now the nasolacrimal boniculum is formed between the maxillary bone and the lacrimal bone. On the behind, the next bone is added. Here is the palatine bone. It is forming the this hard palate. The horizontal plate is forming the posterior part of the hard palate, and here it is make the vertical plate of the palatine bone. It is, you see, it is partially covering the maxillary sinus also. And these are the two processes that are important. These are the two processes of the palatine bone, I think sphenoidal and orbital, and between these two is an opening that is known as sphenoparietal foramen. We will discuss it later. So this is the parietal bone. Here on the red, the sphenoid bone has been added. On the top of it, the sphenoid bone, that is the body containing the sphenoid air sinus. On the back, there is the medial pterygoid plate right here. There is basically the pterygoid process containing of the medial and lateral bones, so medial pterygoid here. So we are almost near the completion, and here is an independent bone, that is the inferior concha. It is an independent bone. So inferior, by adding of the inferior concha, we have completed the definition of the nasolacrimal duct. So it is present between the lacrimal bone and the maxillary bone above, and between the inferior concha and maxillary bone below. So this is the opening that connects your orbital cavity outside to the nasal cavity inside. Then there is the one in the shown in the green right here, that is the ethmoid bone. There here it is only showing the labyrinthine part, the lateral part of the uh, ethmoid bone. So here it is responsible for forming the roof, the cribriform plate. It is responsible for forming the superior concha and the middle concha. And you can see it is almost now covering the maxillary sinus. And on the top, the bone that is added is the frontal bone, and on anterior aspect there is nasal bone. So these are all the bones of the nose. The ethmoid bone is a little tricky bone. It is like a letter M, capital M. It has the lateral processes on the each side. These are known as labyrinthine parts. Light, these are shown by the light green, and in the midline there is a central part that has a horizontal plate on the top, the cribriform plate, with a crystal galli projecting towards the top, and septum going back downwards, that is perpendicular plate that will be forming the part of the nasal septum. And this labyrinthine part, it will include the superior concha, the middle concha. It will have the ethmoidal air sinuses within it, that will come between the nasal cavity and the orbital cavity, and then there will be a space between there will be this bony process. This is the uncinate process. This bony process, this will be the uncinate process. We will be discussing it shortly, and it will be defining the space between the two. It will be spanning this space between the two, that is the hiatus semilunaris for going inside to the infundibulum. Don't worry, we will discuss them separately. So this is about the lateral wall of the nose. This picture we have almost done. On the lateral aspect, you can see the lateral cartilage, the lateral part of the alar cartilage, accessory bones, the part of the nasal bone, the part of the frontal bone, majorly maxillary bone, inferior concha, lacrimal bone, and ethmoid bone with superior and inferior middle concha, palatine process with sphenopalatine foramen, and in the back, the sphenoid bone. If you remove the middle concha, if you remove the turbinate middle concha, and you will be able to see what is deeper to it. In this picture, all of the turbinates, all of the concha has been cut a little, and you can see the different openings. We will be discussing them separately. The thing that I want to focus on right now is this bony process. This is a raised portion that is known as bulla ethmoidalis. That is known as bulla ethmoidalis, that will be forming the that is containing the ethmoidal air sinuses. And the other thing that we need to focus is this bony projection. This is known as the uncinate process. We talked about the bulla ethmoidalis behind and the uncinate process anteriorly, and in between the two there is a gap between the two that is known as hiatus semilunaris, the space defined by the uncinate process and the bulla ethmoidalis. This two-dimensional space, this is hiatus semilunaris. And if we move through the hiatus semilunaris to the space deeper to it, that is known as infundibulum. That is known as infundibulum, and infundibulum is between the orbital plate of the ethmoid bone and the uncinate process. Let's look at the medial wall. The medial wall is quite simple. It consists of, on the higher upper aspect, it consists of the perpendicular plate of the ethmoid bone. On below aspect, it is made up of vomer. Vomer is more prominent posteriorly. When you are looking from the back aspect, you only see vomer. And on the front, between the two, like a triangle, a wedge-like septal cartilage, it's present between them. And that is why you have a very flexible nose. You can actually pinch it and move it on side to side. So it is due to this septal cartilage. It is placed in attached to the ethmoidal plate above and the vomer below. And below there is a small contribution of the maxillary bone and the palatine bone to the septum, nasal septum, and these are known as nasal crest of the maxillary bone and the nasal crest of the palatine bone. Then actually like giving a grooved placement of the vomer right here. This brings us to the floor. This is a picture that is in the coronal section looking from the back, and this is the picture. This horizontal section is cut and we are looking from the top. If we look from the top, the anteriorly, that most of the floor, it is made of the maxillary bone, the palatine process of the maxillary bone, and on the back it is made up of the palatine bone, the horizontal plate of the palatine bone. There will be a suture between them simply known as the palatomaxillary suture, and then there is this structure, the opening, that is the incisive canal, that is communicating this nasal cavity with the oral cavity below. So the floor of the nasal cavity is exactly the same as the roof of the oral cavity, also known as the hard palate. Roof. This was the roof of the nasal cavity all the way front to back. So if we follow the roof from front to back, we will see, and most anteriorly it is made up of the nasal bone. Then there will be contribution of the frontal bone. this is the major part, that is the most important part, that is the cribriform plate. And on the back, on the posterior superior aspect, there will be sphenoid air sinuses. So this is the roof of the nose: nasal bone, frontal bone, cribriform plate, and the sphenoid air sinuses. Sphenoid bone, basically the body of the sphenoid bone. And as you can see now, this is we will we're not discussing the sphenoid bone as a bone individually, but just for the sake of discussion, you can see on the top aspect there is the fossa for the pituitary gland on the top of the sphenoid. So nasal cavity provides an ideal pathway to reach the pituitary gland. This is known as trans-sphenoidal approach. Nasal cavity, the scope is passed through the nasal cavity. You open the anterior wall and then the posterior superior wall of the sphenoid air sinus and reach the pituitary gland. Otherwise, the alternative is to move so many of the bony structures, so many of the nervous tissue of the brain to reach the pituitary gland. So this is about the roof of the nose, and the cribriform plate is most important because it is related directly to the anterior cranial fossa, its meninges, and through it